Hello, everyone, and welcome to Langley Esquire's monthly briefing on Japanese policy. Today, we're going to be talking about innovation and opportunities in the quiet revolution in Japan's medical technology. Japan is aging fast. We all know that. In 12 years, in fact, every third resident will be over the age of 65 years old. It's a demographic cliff that governments fear, economists model with dread, and healthcare systems rarely survive unscathed. And yet here in Japan, we see something that confounds expectations. This pressure has become a crucible for innovation. Outsiders rarely appreciate the magnitude of what's happening here. Japanese policymakers aren't just responding to a demographic decline, they're using it to, among other things, re-engineer the nation's medical system. From gene therapies and regenerative treatments to AI-driven diagnostics and robotic surgery suites, Japan's health infrastructure is evolving rapidly, backed by targeted policy reform and strategic funding. And this is gaining global notice. Foreign patients are increasingly arriving for specialized treatments, some for state-of-the-art cancer therapies, others for advanced orthopedics or experimental stem cell procedures. Medical tourism is no longer a fringe topic. It's now shaping parts of regional hospital planning. At the same time, Tokyo has begun cracking down on foreign nationals who leave unpaid medical bills behind, a sign that the system's financial pressures are very real even as innovation accelerates. For foreign companies, investors, and institutional players, this is a moment of opportunity. But it's also one of complexity, where regulatory nuance and cultural fluency will determine who thrives in Japan's high-stakes MedTech renaissance. So how does the system work and why is it changing? At the center of Japan's healthcare architecture is the universal national insurance system covering nearly all residents through a mix of employer-based national and late elderly programs. While costly, this system provides a treasure trove of structured medical data, something no US or European equivalent can quite match. That data is now being used to fuel AI diagnostics, epidemiological modeling, and the refinement of treatment pathways in ways that are years ahead of other markets. But cost control is a growing crisis. Health-related social expenditures now consume over 10% of GDP, with the proportion rising steeply. The government simply cannot throw more money at this problem. That is why we are now seeing something novel in Japanese policymaking: controlled experimentation. Here are the key players. The Ministry of Health, Labor, and Welfare is the gatekeeper of national health policy, coverage decisions, and clinical trial approvals. Then there's the Pharmaceuticals and Medical Devices Agency, Japan's FDA equivalent. It is now accelerating reviews through conditional approval tracks and regenerative medicine fast lanes. The Ministry of Economy, Trade, and Industry is driving industrial innovation, particularly for AI diagnostics and robotics. Then there's the Japan Agency for Medical Research and Development. This is the quiet engine behind transnational research funding, including public-private consortia and university lab-to-market pipelines. In recent years, we've seen Japan roll out a major policy shift to accommodate this changing landscape. These include the Regenerative Medicine Law of 2014. This is a global pathway that allows for conditional, fast-track approval of stem cell and gene therapies after limited clinical trials, provided strict post-market surveillance. Then there is RWD and RWE inclusion, the gradual institutionalization of real-world data, which is RWD, and real-world evidence, which is RWE, into trial and regulatory decisions. International harmonization. Through ICH and other mechanisms, Japan is aligning more closely with the EU and US trial standards, smoothing the path for foreign firms to gain inclusion, which is difficult even under more favorable conditions. The message is clear. Japan is adjusting its regulatory architecture to embrace controlled innovation. The question for foreign players is, as it almost always is, can they understand and engage quickly enough? But here are some breakthroughs that nobody's quite talking about yet. While the West debates regulatory bottlenecks and insurer paralysis, Japan is moving at a breakneck pace. You can sense the urgency and the drive. The nation has become, in fact, a quiet proving ground for technologies that still face friction elsewhere. Who would have thought? Just leave it to Japan. Then there's AI diagnostics and image recognition. While similar technologies are discovering staircases under Egypt's pyramids, Japanese firms like L-Pixel, Nissin, and Fujifilm are pioneering deep learning algorithms for early cancer detection, diabetic retinopathy, and CT scan precision analysis. These tools are already integrated into clinical practice, not in pilot programs, but at scale. METI's Smart Hospital initiative provides subsidies to hospitals that adopt AI-assisted workflows with the aim of reducing diagnostic lag and enhancing remote triage in aging regions. As for robotic surgery and rehabilitation, companies like Cyberdyne and Medicoroid are transforming surgical suites with next-generation robotics. Meanwhile, exoskeleton technology is no longer science fiction. It's deployed in elderly care and in physical therapy, allowing aging patients to regain mobility and dignity. When it comes to regenerative medicine and cell therapy, Japan's conditional approval pathway under the 2014 Regenerative Medical Law means treatments that might wait 8 to 10 years for full FDA approval can go to market in Japan within 2 or 3 years. Companies like Helios, Megacaryon, and JCR Pharmaceuticals are leading in iPS cell therapies for stroke, graft versus host diseases, and rare disorders. So don't underestimate Japan's bio-startup scene. PeptiDream's peptide discovery platform, for example, has become a global gold standard, licensing technology to major Western pharma players. The firm is publicly traded, profitable, and headquartered in Tokyo, yet under the radar from many foreign analysts. So why should foreign capital be paying attention in the first place? Foreign firms often write off Japan as impenetrable, too regulated, too isolated, too Japanese. That assumption is now outdated and increasingly costly. Japan is not only reforming policy, it's quietly welcoming foreign capital into its most sacred space, the national health insurance care. Here's how and here's why. In the Keihin coastal area, which includes Tokyo and Yokohama, Kobe Biomedical Innovation Cluster and the Shonan Health Innovation Park have created dedicated area, IP, and tech transfer frameworks to attract foreign MedTech ventures. METI and JETRO now offer concierge-level support for life sciences firms entering the Japanese market with special incentives for startups working on cancer, neurodegeneration, and rare diseases. While Japan has historically been seen as a final phase trial market, that's changing. The PMDA now accepts global trial data more readily, and Japan is integrating real-world evidence from hospitals and insurers to support early decision-making. For firms with therapies aimed at Asian populations, Japan offers unparalleled access to high-integrity data sets, ethically and legally sound. It's fairly well known that Japanese patients are among the most compliant and tech-savvy in the world. Remote monitoring, wearable diagnostics, and AI apps enjoy broad acceptance, especially among older patients. And in contrast to many markets, trust in hospitals, physicians, and government agencies remains strong, a crucial asset for public-private pilots. Perhaps most important, Japan's MedTech transformation isn't a trend. It's a policy response to demographic survival. This means funding, political attention, and regulatory alignment will continue long after other countries' attention shifts. Foreign players who understand this will have a decisive first-mover advantage. But this is Japan, and barriers still matter. For all of its progress, Japan remains a uniquely hard market to break into, even for firms with capital, credibility, a history measured in decades, and cutting-edge technology. Attempting to address this has been my whole career. And while Japanese snow is different and Japanese stomachs are longer, type obstacles come up from time to time, they aren't insurmountable. And yet they matter to those who promote it. Clearly, Japan's review processes have become faster than they used to be, but it's still layered. Multiple agencies touch a single product's journey. The PMDA may fast-track your approval, but Ministry of Health, Labor, and Welfare sets the pricing, and the reimbursement system adds a third axis. Coordination is improving, but foreign firms still find themselves facing kind of lost in translation delays, both linguistic and institutional. Admittedly, it can get maddening, but then again, that is already a well-known feature of cracking the Japanese market. And at the same time, we have the Galapagos effect. Devices developed in Japan often stay in Japan. Standards, workflows, and IT architecture sometimes diverge from global norms, making integration harder for foreign systems. Local players benefit from this insularity because it creates artificial onboarding friction for international players. The government is aware and has started a harmonization push, but the cultural default remains focused inward, and you cannot forget the deeply entrenched business lobbies. And then there are the politicians. AI in healthcare depends on access to large, high-quality data sets. Japan has them, but sharing them is another story. Despite national databases and My Number integration efforts, privacy concerns and institutional silos still slow the flow. And while the government has issued ethical AI guidelines, compliant mechanisms remain loose, making investors cautious and deployment slow. Hospitals still struggle with IT staffing and digital literacy among administrative personnel. Well, let's just say it varies widely. At the leadership level, institutional conservatism often curtails pilot programs unless pushed from above. Innovators need champions inside the system, and many a foreign firm arrive without them or choose the wrong one going forward. Japan's biennial drug and device price revisions are part of a broader fiscal discipline effort. That's good for national budgeting, but it injects uncertainty into long-term ROI calculations. Reimbursement reform is needed and is quietly underway, but this is one area which also remains a key hesitancy for investors. So, Japan is not a country that changes quickly unless it must, and today the general acknowledgement is that it must. Healthcare is the final anchor threatening to swamp the national budget. The country's population is shrinking, the tax base is aging, the time for incrementalism is gone. This is why MedTech is being granted an unusual degree of political cover, regulatory flexibility, and cross-ministerial alignment, not out of ideology, but out of survival. For international players, timing is similarly critical. The Bank of Japan is shifting policy. Japan is entering a higher inflation, higher wage environment. COVID exposed digital weaknesses and unlocked political will for health tech modernization. Foreign capital is not just tolerated, it's being quietly invited, especially in frontier fields. In fact, the government is signaling through policy that the rules of engagement are changing. And yet, most foreign observers still see Japan through the lens of the 1990s rigidity. That's a costly blind spot. The reality is Japan is ready to partner, but only with those who understand how to navigate its inner rooms. So just to leave you with a final thought, Langley Esquire just doesn't analyze policy, we live it, we are engaged in it. For over 3 decades, we've helped foreign companies, global investors, and high-level stakeholders navigate Japan's most opaque systems, not just in healthcare, but across energy, defense, AI, and consumer markets. What makes the MedTech movement different is its urgency and its current openness. Japan is quietly signaling that it needs partners, but not just any partners. Those who can listen closely, understand cultural nuance, and work inside the policy architecture to shape outcomes. The rewards for those who succeed are enormous. Access to a compliant, affluent, tech-savvy population in one of the world's safest and most stable countries on Earth. So if your team is exploring market entry or expansion into Japan's MedTech, digital health, or regenerative therapy sectors, if your advocacy is built around reimbursement, IP, or regulatory flexibility, if your engagement involves that with the government agencies for pilot programs or grants, and if you have customized research into the shifting policy frameworks or public-private opportunities, we can help you. Let's make sense of this moment together, because this isn't just about healthcare. It's about a generational pivot in how one of the world's most advanced societies cares for its people and invites the world to help. It is a laboratory for the rest of the advanced nations who have also enormously been impacted by declining birth rates. Japan is not the only one, but it just happens to be the first. So please reach out to Langley Esquire to learn more, or explore our additional insights at Langley Esquire on Substack, on our webpage, or on our YouTube channel. Thank you for participating in this policy update. Please continue to stay tuned for more in the near future.